I am a senior technology analysis and marketing specialist with the National Cancer Institute. And my role primarily is to help create awareness for companies that aren't aware that they can actually work with NIH beyond the general thought of just getting funding from the NIH. And so this talk is primarily designed to give you guys insight into what's on the other side of the funding thought process from NIH so that you can actually enhance your collaborative and engagement with the NIH to help yourself or help your companies either grow the company based on our technology, expand pipelines, expand your company's pipelines, or actually collaborate with our investigators to develop your technology or help develop ours. So with that, let me see if we can see my screen now. There's a perception out there that when people are thinking about NIH, they're only looking at NIH as a funding mechanism. And so the perception is that it's only a source of funding. And so those thought processes lead people to file and submit grant proposals and also contribute to our Small Business Innovation Research Program, or our SBIR program. And that's an excellent program. And it is primarily designed to help companies grow their technology with the assistance of NIH, like any other grant program. The perception is that it's only funding, NIH is only a funding source. Your instincts are correct in that thought process, but NIH is actually more than just a direct funding source. When you're thinking about funding with NIH, you're really thinking about the NIH extramural program. So the money that Congress provides the NIH every year, 80% of that budget goes to putting out grants. So the money leaves NIH in the form of grants. And that's what you're thinking about when you think about getting funding from NIH. But NIH is more than just a direct funding source. The other remaining 10% or so, somewhere between 10 and 20% of our budget, goes to the intramural program. And the intramural program funds all of the research that goes on in the labs on NIH's campus. And so what we have on the intramural side for companies is access to NIH developed technology through licensing and collaborations. But we also have, from the collaboration perspective, we are able to co-develop technology with the company, either our technology or the company's technology, provided that there's a synergistic match between the NIH and the technology that the company has. But we provide indirect funding in the sense that NIH will actually spend money on the company's behalf. And a lot of companies are unaware of that. So, for example, if there is a clinical trial that the NIH is funding or sponsoring, rather, the company that is collaborating with NIH on that clinical trial would not necessarily get the cost of the clinical trial. So think about how expensive a clinical trial costs. Let's say it's $1 million, all right? So we won't give the company $1 million, but we will spend $1 million on the company's behalf because NIH actually pays for the trial, right? So the thing that the company has to worry about is the company may have to provide the drug, they may have to provide staff to help run the trial, but the overarching cost of the trial is actually spent on NIH's dime, and the company doesn't have to worry about that money coming out of their burn rate when they're moving forward with whatever they're pursuing. So that's one aspect of the intramural side that a lot of companies are unaware of. Another thing is companies have a tendency to go to university technology transfer offices when they're trying to source new technology. So they'll go to Carnegie Mellon, MIT, and some of the other universities that are listed on this slide, which are great universities, and they have fantastic technology, right? The thing that they're not thinking about when they do this, though, is that the universities they're going to are actually profit centers. So when you license a technology from a university, such as what's listed here, they're going to charge you for exclusivity, right? And they're also going to take some type of equity from your company for the privilege of licensing their technology as well. So you have to think about that when you're licensing technologies from universities. Now, we are a little different in the sense that if you're not looking at NIH as a source of technology, you're really missing out. And the reason you're missing out, for example, is the NCI, the National Cancer Institute, has had 15 product approvals in the last 7 years from licensed technology. Also, we've created or generated over $10 billion in revenue from the royalties that come from our licensed technologies that are co-developed with NIH. We have over 2,000 partnerships and collaborations with companies outside of NIH helping to develop technologies, either NIH's or the companies, right? So this graphic basically shows you where most of the total VC money raised in 2022 came from in terms of technology area, right? So if you look at the top, oncology is the top investment target, and all of the other diseases down the left-hand side of this column are also represented. So you can see that a tremendous amount of money has been invested in patient health, so to speak. But the thing is, a lot of companies don't know that NIH is actively developing technologies in all of these areas, right? And that also includes diagnostics and devices and non-medical devices and the like. So they could be used for any of these specific disease indications. So companies are unaware of that as well, okay? So another thing that companies aren't aware of is that NIH is the largest research institute in the world. We have over 2,800 technologies that are available for licensing and collaborations. And so the nature of the technologies that we have cover medical and non-medical devices, diagnostics, software, apps, digital wearable health, and obviously therapeutics and research materials. And these research materials cover things like antibodies, cell lines, and animal models that companies can use in their research and development to further their own research to get to their own technology or their own therapeutics or devices or things that they're creating on their own. They can use our research materials, our research tools to help facilitate the development of their technology. And they own the device or the underlying technology that's created from using these research tools. And then the other thing is we have favorable business terms. Now, I'm going to go back to the universities for a second. I said that universities are profit centers. So if you're going to license a technology from a university, you're going to pay a premium for exclusivity, and they're going to take equity. If you collaborate with the university, they're going to charge you overhead. So if you put in $3 into a research collaboration with the university, more than likely, $2 of those dollars are going to be used to keep the lights on, pay the staff, and keep the stadium, running smoothly, right? So unlike universities or tech transfer offices, the NIH has more favorable business terms. So our terms are basically based on just getting a fair return on the public dollar that created the technology that you're licensing. So we're not trying to kill you with royalty rates, okay? We also don't take equity in your company. So that's a whole lot less money you have to worry about coming out of your burn rate for the development of your particular technology or just keeping your lights on. And then we do have exclusive licenses. Now, it may be limited by field of use, but exclusivity is available. Our collaborations don't have any overhead. With the exception of NIH, it's capped at 15%. But NCI, National Cancer Institute, has capped there at 15%. So 27 institutes don't have any overhead. So if you license technology from any of the 27 institutes, with the exception of NCI, you won't see any overhead. We also have reasonable milestone payments and royalty rates. Again, we're not going to charge you a premium for exclusivity. So our royalty rates are going to be basically designed to give a fair return on the public dollar that created the technology. Another interesting thing is we won't take your IP. So if you bring IP into a collaboration, that's your background technology. We have our background technology, and we combine the two to make something new. If we create something new, then we jointly own it. But because the NIH can't commercialize technology, we license our ownership rights in in that new technology to the company, and the company takes that and commercializes it. Okay, and then you also get a right of first refusal for an exclusive license when you collaborate with us as well. So we're not going to compete with you, right? So situations have occurred where a company has partnered with an organization and the organization has turned around and started a new company and ends up competing with the person that they collaborated with. We don't do that. Okay, so again, we're really trying to help facilitate economic development by helping companies develop and grow with their technologies. And another thing is we have a preference for small business, right? So it's actually part of our mission statement for us to promote small business. So if people are concerned about, well, if I license this technology and say Merck comes in and they want to license it too, how do I compete with Merck? Well, you're not competing with Merck because Merck is huge and you're a small business. And so we have as long as you have the ability to, commercialize, develop the technology, get it to patients, commercialize it, et cetera, then you're going to win out over a larger pharma. Okay, that doesn't need it because they're not really contributing to that development of
this is great
economic development, right? Yeah. And I think I'm running out of time. If I can run through this real quick. So these are some of the benefits of licensing the technology. Licensing leads to funding. You can see here that several companies have licensed technology and raised funding based on the technology that they've licensed from us. Also, collaborations lead to acquisitions as well. So these companies have collaborated with us, and you can see, for example, Kite is the most recent, where they were bought by Gilead for $11 billion based on the technology that they licensed from us. And then the last slide, I'll go through this very quickly. This is a collaboration example. We partnered with a company that created a wearable sleep device that measures sleep that you would see in a sleep center. It's something they can wear in their personal, and they're at home in person. And we partnered them with the National Institute of Diabetes and Kidney Diseases to do a study. And this study using this device helped save the study because the patients were required to go to a sleep center and they didn't want to do it after the first time. And so we partnered this company with the investigator. The devices were given to the patients in the study. They wore them without any problem, and the study went off without a hitch. And these are all the things that we did for the company as well. And then they were able to take that experience with NIH, raise money on it, partner with the Veterans Affairs to help manage the VA and their sleep centers. And they created something called a Somno ring, which essentially is a ring that replaces the band that you see on the top left that patients would wear on their or across their chest. And then they launched their own independent diagnostic testing facility and won a major award from that. So these are all the benefits of working with the intramural program from the NIH. So if you're thinking about looking at just the extramural side with grant funding and the like, you really need to consider working with the intramural side, and feel free to reach out to me. Here's my contact information, and we can have a more in-depth conversation from that point.